Hello and welcome to the Medicare Team podcast. My name is Thomas Falmer and I'm joined here with my coworker. His name is Josh Gerlach. Josh, I think you had a story you wanted to share here, before we actually got into, what we're going to be talking about today.
Yeah, I was out and about this week and I was at a restaurant and I happened to bump into a woman that I knew from church just growing up. And we were talking about what I do now. I was talking about how now I work in insurance and I work in Medicare. And what she'd mentioned to me was she was actually turning 65 and she had no idea what direction to go with it. She didn't know what she needed to do. She didn't know the order of operations. She didn't know how she was supposed to be covered, what she needed, what she didn't. She didn't really know where to turn. And it's crazy because, we talk to so many people that they just don't know what to do when they're starting insurance, when they turn 65, when they're starting that Medicare. And one of the biggest things I've learned in my time in insurance so far is that insurance is somewhat simple. It's just laid out very difficult. And so when you have an agent that you can talk to that will really untangle all the wires for you, you can really start to understand what you have. So you make sure you're getting the right coverages and, you have what you need, you don't have what you don't need, and that your health and your wallet are protected. So, fortunately, even in the situations where I'm out in public and I get to talk to people or, when somebody call in and talk to me, I can really kind of help to untangle some of those wires and it's fun. It's kind of like a puzzle at that point.
Yeah. Yeah, absolutely. Well, thank you for sharing that story. I think what you said that a lot of people will really resonate with was that you know, Medicare and insurance is, for us not confusing, but to them and the way that it's presented to them is very confusing sometimes. And it can be, super overwhelming, especially when you're turning 65, because that's when you have to get all of this set up or, you face the Part B or the Part D penalties, and those scary things that are involved with, not getting everything set up on time. So that's exactly what we're going to be talking about here today is turning 65, what options you have when you turn 65, the timelines behind them. We talked about some of this stuff on previous podcasts, but we really, really want to focus in on, your 65th birthday and what you can expect. So the first thing is, I want to get out of the way and just make sure that everyone understands is the penalties, right? Because that's the scary thing that people are afraid of, that if they don't do it on time, where do the penalties come from? How much are they? Are they going to affect you in any way? So, to start out, the Part B penalty. So for Medicare Part B, that is a 10% penalty related to the Medicare Part B premium. So this year, the Part B premium is $202.90 every month. So a 10% penalty would be you're going to be looking at around $20 per 12 months that you go without Part B. Now, obviously, the Part B premium is subject to change every year. Last year it was $185, I think.
Hmm.
Yeah. So last year was 185 in 2025, 2026 it has increased to $202 every month. So a full 12 months without getting Part B after you're qualified for it, if you don't have another reason to not have Part B, is going to cost you around $20. And that is for life as long as you have Medicare. So that's one thing that you really, really want to be aware of is that penalty that can cost you after a year. The other penalty that people see very often is a Part D penalty. Now, that is your drug penalty for your medications if you don't have what the government considers a creditable drug coverage plan in place. Now, whether that be, for veterans and VA guys, men and women that have drug coverage through the VA, that is considered creditable drug coverage. So you wouldn't have to have a separate Medicare plan in place to supplement your already existing VA medication coverage. You'd be good there. The government considers that creditable, so you wouldn't have to have anything else. But for people that don't have VA benefits, even if you don't take any medications, okay, you still are going to want to get a Part D plan in place. And that is so you don't have to face that Part D penalty, which this year The national average is, what was it, 30 cents or
It's like
30
39 cents a month, I
39
believe.
cents a month. Yeah. Is what you can look at, and after, let's say 5 years, that really adds up because it's based on a monthly basis rather than yearly with Part B. Um, so that's something you really want to take into consideration. Like I said, even if you don't take any medications currently, you're healthy, you don't take anything for blood pressure, cholesterol, anything like that, you still want to have a Part D drug plan in place. So, I really wanted to touch on the penalties and, how those go into effect and how they affect everybody differently. So that was the first thing. Another thing that I wanted to talk about to kind of segue into that is the options that you have when you're turning 65. So, obviously, everything that we talk about, everything that we have talked about up to this point being Medicare Advantage, Medicare supplement plans, those are basically the two routes that you want to go and that we see pretty much everybody on Medicare go to when they turn 65.
But I
So,
think what's important is because I mean, we talked about the penalties that are there, but what's important as well is the first thing you need to do is get your A and your B set up with your Medicare. And you can do that, leading up to your 65th birthday. Part A, as long as you've worked 40 quarters, or basically if you work 10 years in your life, Part A is going to be a $0 premium. You're entitled to that because you worked those quarters throughout your life. And then Part B, is right now in 2026, it is 202.90 a month. So $202.90 per month. And then you'll have those set up to start the month of your 65th birthday. Once you have those, then you can really get in touch with, like Tom's is saying, whether you go with an advantage plan or a supplement plan. Kind of look at it as like, the fork in the road, which direction you want to go and what is right for you.
yeah. Well, thank you for catching that, by the way. I almost skipped right past that. Yes, the first step in your Medicare journey, like Josh was just saying, is to get your Part A and Part B in place. And you can do that on the Social Security website, Social Security Administration website, which is ssa.gov. It's very easy. We actually have a quick tutorial on our website at the medicareteam.com on how to sign up for Medicare. It's a quick video that shows you exactly where to go on the website and what to do to make it very easy for you. But yes, once you have that in place, your Part A and Part B, which you can do, I think you touched on it, 3 months before you turn 65. So if you turn 65 in August, you can do it in May, for example. Um, Once you have all of those set up, obviously that is when you're looking at your other two options because most people don't just have original Medicare, Part A and B, as their only coverage. Most Americans have either an Advantage plan or a supplement plan in place to cover them, more comprehensively than just original Medicare, which is just A and B. So, um, and then, there's also some other protections in place, right? That other people, I just spoke to a gentleman on the phone today. His mother, actually, he had to, not his mother, his wife in this scenario. His wife unfortunately got diagnosed with breast cancer and she was obviously wasn't working. She was very sick. And then he had to take off of work to, take care of her until she, sadly passed in the near future from being diagnosed. And he was really wondering whether or not, does Medicare cover home health care or do they cover skilled nursing facilities or long term care? And the answer is to a degree, they do, but not after 100 days for, long term care. As a lifetime, benefit maximum, you have up to 100 days in a skilled nursing facility with original Medicare, and that is covered under Part A. So from days 0 through 20, you are covered at $0 with Medicare. They cover you from day 0 to 20. You don't have any costs in a skilled nursing facility. From days 21 through 100, you're going to be looking up to a maximum of $217 per day for skilled nursing. And then from days 101 beyond, you are not covered whatsoever. Medicare covers nothing. So In his wife's situation, she was not covered after day 101 at all. He could not obviously afford to pay every single day that she was going to be, needing to be in a skilled nursing facility. So he had to take time out of, his life, his work. He was unemployed at the time, and obviously so was she, which caused, major financial issues with them. Um, and he had to, take care of her until she passed. So when we look at all of these things, there's a lot of unknowns as to whether or not there's things that you need, things that you don't need. And, we've said this before, Medicare is not a one size fits all insurance plan. It's not. Not everything, that everybody has, you're going to need. And then there's some things that you might need that everybody else doesn't need. It's just all based off of, what you're going to need for yourself in your specific situation. So, we here at the Medicare team, we kind of, simplify what people need, right? So that takes us into, our packages here, our umbrellas, what we offer. So umbrella one is just, the basic package. It gives you your major medical insurance, which is your Medicare, and whether that's a supplement plan or an advantage plan. And then it has an additional either, cancer, heart attack, and stroke protection plan or a hospital indemnity plan based on what you need. And we also have a podcast describing and going in depth about what the, cancer, heart attack, and stroke and hospital indemnity plans cover. So if you want to go check that one out, you can definitely, we'll put a link in the description below so you can click on that.
What a great way to kind of summarize that, especially for cancer, heart attack, and stroke, is if you, especially if you have family history of cancer, family history of heart attack and stroke. I believe right now in America, for retirement age, 1 in 2 men will get cancer, 1 in 3 women.
Yeah.
And so, what these policies do, you set an amount. So, I actually helped a woman out today. And now, God forbid, she gets cancer, she's going to get a payout of $25,000. And
Yeah.
a heart attack or a stroke, she's going to get a payout of $15,000. And that's going to
Wow.
be tax free lump sum paid. She's going to get paid that, and she can use it for whatever she sees fit.
Yeah.
And so it's protection for, it's the unknown, but these health concerns are inevitable because at some point they're going to happen, whether we're ready for it or not. And one thing I've spoken to people that think, oh, instead of paying that premium, I could just be saving that aside. And I think a lot of people get the idea that they can save that aside, but they won't end up saving it aside, or they'll use that money for other things. And then when these, terrible, inevitable health concerns hit, then they don't have the money prepared. And then they kind of
Yeah.
wish they would have gotten themselves protected. And it covers a lot of that gap there.
Absolutely. Yeah, that's a very good point. To share a quick story about, a gentleman that I actually talked to a couple months ago. He had nothing in place as far as even a supplement or an advantage plan. He had only original Medicare. So he just had A and B, the 80% coverage from Medicare, and then the 20% of his out of pocket. He unfortunately needed a surgery. And that surgery costed around $115,000. So Medicare covered 80% of it, and he was stuck with, a $26,000 bill himself. He was on a fixed income already. He didn't elect to have a supplement plan because he couldn't afford it. And he also, I'm not sure why he didn't have an advantage plan at least, to where it would have, at least had his maximum out of pocket there to help him out. But he had to file for bankruptcy. He couldn't afford to pay rent anywhere. That one surgery flipped his entire life upside down. So, when Josh is saying that, these things are inevitable, it's the truth. And we speak to people every day. And I think, it's one of those things that you don't really think about until it happens to you or somebody that you know. So, getting this stuff in place right now, it's so important to do it while you're younger and you can have it. It's affordable, something that's not going to break the bank, but still have you protected in case these things happen. So, thank you for that, Josh, as well.
I do think a great point to bring up, because something I get asked regularly is, well, if I have basic Medicare, I have my A and my B, why do I need Advantage or why do I need a
Yeah.
supplement?
Yep.
And that story is a perfect example because with basic Medicare, yes, Medicare is going to pay 80%, you're going to pay 20, but that 20% is uncapped.
It's uncapped.
So one surgery for that guy cost him $27,000 because it's 20% of any number that they throw at you, you're responsible for. Whereas, for instance, if you're on a fixed income and you go with an Advantage plan, they're going to have a max out of pocket. So at least they're putting a cap on what you could be responsible for paying,
Yeah.
which is a heck of a lot safer and a heck of a lot smarter than just 20% of, whatever hill could be thrown at you. So
Absolutely.
it puts that cap and it puts, again, the word really comes down to protection and making sure that your health and your wallet are equally protected
Yeah.
and you're not going to, put yourself at risk for these huge financial losses. Like, I mean, I don't know about you. If I had a $25,000 surgery come up tomorrow, I'm not prepared to handle that right now.
Yeah, no, I'm not either. And I think that's the reality for most Americans, right?
Mhm.
Most people aren't going to be able to just shell out $40,000 for a surgery,
Nope.
and be okay to, go on about their day after that. That's just not a reality for most people. So, getting back into the umbrellas, right?
Mm.
Umbrella one, that's the most basic package. If you feel, you've been healthy your entire life, you have no complications whatsoever, at the very minimum, that's what you're going to want, right? Either an Advantage or a supplement plan, and then at least a cancer, heart attack, and stroke policy to pay you out. Umbrella 2 gets a little bit more comprehensive there. That is going to be your Advantage or supplement plan, cancer, heart attack, and stroke, or hospital indemnity, as well as the like either dental, vision, or hearing, or something along those lines. And then Umbrella 3, that's going to be your most comprehensive, where it includes all of those things, and then also a home health care plan in place on the side of that as well. So it all boils down to, you don't want to break the bank every month, but you still want to have protection in place, right? So, if you can't afford $500 to $700 a month for health insurance, that's completely understandable. A lot of people can't afford that. Um, and a lot of people don't even need it, but it is nice to have the protection in place, but you still want to be able to afford that. And if Umbrella One seems more, helpful for you, then that's obviously the route that you should go for that. So,
Yeah, and when talking to people, especially when I'm working with somebody who is just turning 65, honestly, one of the fun parts about that appointment for me is it's kind of like painting a picture. They're giving me all these details and these thoughts about their health history, their family health history, what they've been through, what kind of doctors they see. And we can kind of, as agents, get to build that picture and make the right recommendation for them about what care is going to be comprehensive for them. My goal as an agent is not to just sell somebody everything that I can find for them and try to, make you put half of your income into healthcare because, I don't want to put half of my money into
right, of
healthcare.
course not. Yeah.
But I want to talk to somebody. I want to make sure they're properly protected. That way, when life happens, when uh, disease happens, when injury happens, when any of these inevitable life events occur, someone is protected and they can kind of live with the peace of mind that when these things occur, your finances are protected. You are not going to, worry about, can I keep a roof over my head? Do I have to go bankrupt?
Yeah.
And so I think peace of mind is really the biggest thing that when you take care of somebody and when you get your Medicare set up properly, peace of mind is what you are taking home with you there.
Yeah, absolutely. Yeah. That's a very good point that he just brought up. Having not just the coverage in place, but, not having to deal with the anxieties of, oh, what if this happens? Knowing that you're protected, and that you chose the right, plan for you is a really, that's something that's free of charge, obviously, but, helps you sleep at night, right? If something were to happen.
Do you know how cool it is to be able to just remove the what ifs on something as big
Yeah.
as your medical insurance
Yeah.
with your health? What if this happens to me? What if that happens to me? Oh, I'm not worried about it. I actually have that covered. So
Right.
now, one of the biggest, most honestly, life is the most fragile thing out there.
Absolutely.
And so, one of the most fragile pieces out there, life, now you're protected. You don't have to worry about the what ifs or if this happens. You just say, "Oh, yeah, I mean, if that happens, I have all the medical protection I need. I don't have to sweat about that."
Yep. Yep. And that's so big for some people too, right? Like, I know for myself, I'm such a hypochondriac. I'm always worried that something's wrong with me. So I actually have myself, I have a cancer, heart attack, and stroke policy in place. So if I have cancer, God forbid, or I get, have a heart attack or a stroke, I'm going to be paid out $75,000 untaxed that I can either, use for the treatment if that's the route I decide to go, or if, whatever I want, if I want to go to Disneyland or wherever I want to go, right? Like I can use it for whatever. So,
Now, of
um,
course, you could take the Disneyland, but right now, over half the cost of cancer treatment has nothing to do with
yep.
cancer at all. I mean, it doesn't have to do with the treatment, it has to do with traveling to the treatment centers. Some
Yeah.
people want to have their family with them. If you want your partner to be nearby you, whether you need a hotel or an Airbnb, there's transportation costs, there's food costs, and it's a chunk of time commitment there. And so even just something as simple as using it to keep the lights on in the house, keep your dog fed, you know?
Yeah, absolutely. And then, like I was saying earlier, turning 65 is a confusing time.
Mhm.
And Josh said it best earlier when he said, as an agent, it's like a puzzle, right? You got to find all of the pieces, and that's the pieces being the questions that we ask you all for what fits best for you. So being able to really untangle that and, find what works best for you guys, that's what we do here as agents, right? That's what we do every single day. That's what we've been doing, what we'll continue to do. We really, really love helping people out. I know, I have a lot of conviction in what I do, and I know Josh does as well. Um, like he said, being able to help somebody and, see that somebody that you helped really, really took advantage of what you helped them out with, right? Seeing obviously it's not great if somebody gets cancer, but knowing that they're protected and you were the one that protected them, that really gives, me a lot of joy. I know you as well. So, turning 65, we have been specializing in that for a bit now, helping people that are specifically turning 65 because they have the most questions, right? Like they haven't been on Medicare before. They haven't had to deal with any of this, the talk that we deal with every day. Some of them don't even know what copays or coinsurance or deductibles are. So, that's what we're doing here at the Medicare team is trying to really paint a picture, simplify it for you guys, and, just find whatever's, out there that would be best for you. So,
And frankly, throw the gambit of information at the agent you're talking to.
yeah.
I don't know. Let's see. Should I go Carmen San Diego or should I go Pink Panther? I think those are both
hmm
appropriate references to throw here. We get to sleuth it out and we get to see, okay, well, if these are concerns of yours, here's how we can alleviate that. And here's how we can help you find peace of mind to where once we have all this set up, it's set and forget. You don't have to worry about it. But if something comes up and you need something in your insurance adjusted, we're not one and done. You pick up the phone, you send us an email, you call us, and we'll see what we can do to make sure that your coverage is taken care of, which is why I always tell people find an agent you like and stick with them. That way, you're not constantly having to tell a new agent about your story, about what your concerns are. You can say, hey, Thomas, I had this occur, or I have this concern coming up, or, my sister just had a heart attack. I'm scared I'm going to have one. I don't want to have that happen. What kind of protection we'd find there? And then we could talk about, the cancer, heart and stroke plans, or, you know, uh, my cousin just passed and they didn't have anything in place. And now our family has all of this debt going on.
Yeah.
Well, there's those final expense policies that,
Yep.
make sure that your final expense is taken care of. It pays out to the family. So, bills, funeral costs, all of those end of life charges are taken care of. So it's another peace of mind for what you're leaving behind to your family.
Absolutely. Yeah. No, I mean, you put that beautifully there. I mean, and like I said earlier, these most people don't have anything in place and then it happens to them and it's unfortunate. It bankrupts them, quite literally. They have to start digging into assets. They're digging into their retirement, digging into, what their bank account that they've been had in savings for 20 years. It's just really sad to see. And the best part about all of this is there are ways to protect yourself from that. And that is exactly what we try to do here with you guys. is protect you from things that, time has told is inevitable, right? He brought up the stat of 1 in 2 men over the age of, I think, 50 or 55 get cancer, and 1 in 3 women. That is half of all men. If you make it that far, is you were, 50% chance that you're going to get cancer. So banking on that happening, acting as if it's for sure going to happen, obviously that's a scary thought, but the best thing you can do is protect yourself from it, going forward. So
And let's be realistic, a lot of what you talk about when it comes to insurance and Medicare and turning 65, things like talking about the potentials of cancer or heart attack, stroke, final expense, they're uncomfortable topics because it's your health. It's, what if I get super sick? What about when I pass? It's uncomfortable topics, but they're so important to talk about because it becomes so much more difficult to navigate them once you've already hit that chapter. So, you get yourself set in advance. You have those conversations it makes your stomach churn a little bit, but you can then get it set to where you don't have to worry about it. And then, God forbid that does happen, you don't have to stress like you would have.
yeah, absolutely. Okay. Well, I mean, I think that's all the time that we have for today. I appreciate everybody that tuned in. Josh, I appreciate you coming along with me here today on this podcast, and we'll see you guys in the next one.
Thank you for tuning in. Have a good one.